Hi, welcome to The Confident Patient in a New World. I'm your co-host, Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. With me today is my co-author of The Confident Patient, Wendy Benson. While The Confident Patient book outlines interviews and conversations with medical staff, we quickly realized that these conversations must continue past its pages. So we're talking with medical professionals about all sorts of challenges patients and their caregivers are facing now, given so many changes in healthcare. Joining us today is Dr. Andrea Madrigrano. Dr. Madrigrano is a breast surgeon and co-director of the Breast Cancer Service Line at Rush University Medical Center. Let's start with some of your recent experiences as a breast surgeon, and I'll turn it over to Wendy.
Thanks, Beth. And Dr. Madrigrano, we are so glad to have you here today. Thank you for joining us.
Thank you for inviting me to participate in this discussion.
Absolutely. So to start us off, can you tell us a little bit about the Breast Cancer Service Line at Rush?
So Rush has been a leader in the multidisciplinary care of cancer. For over 4 decades, we've had a clinic where we see patients together as a surgeon, a medical oncologist, and a radiation oncologist to help a woman with a new diagnosis of breast cancer understand the steps necessary for her care. It starts with an initial phone call from our breast cancer navigator who helps outline expectations and make sure we have all the necessary records. And kind of that navigation continues on through from her first treatment to the last treatment into her survivorship period. Or I should say his survivorship period.
That navigator is amazing. I will call her and give her a name of a patient. And just for getting the records from the other institution is life-changing. Like, it just really speeds up the process and really gets you like ready to go in the right direction.
What also is great about the navigation is a patient never feels lost at Rush. There's always a personal phone number to call, a voice on the other end, and not a series of robocalls that you have to navigate through. So really, we want to make sure that our patients know that we are personalized and here to give them care in a real-time way, not thinking that they're just another number in our system.
That's great. Thank you.
And what a difference that makes at a time when people are feeling so vulnerable.
Exactly.
So talk us through, if someone's preparing to have breast surgery, how do they get ready for both the before and the after?
And really, there's 2 big surgeries we do. The simplest is a lumpectomy, which is just a same-day surgery. Sometimes we check nodes, but the patient comes the morning of surgery and we'll be home a couple hours later. That recovery is very different than a mastectomy patient who undergoes breast reconstruction. But really understanding the surgery, why we're doing the surgery, understanding the choices between a lumpectomy and a mastectomy is the best way to prepare yourself from an education standpoint. A lumpectomy is rather simple to recover from. It's just a couple of days where we don't want you doing any heavy lifting. Whereas a mastectomy with reconstruction is a month-long process, which involves a lot of different aspects of the recovery period.
And so what are the most important things that you communicate with the patient's family or support system?
Well, it's been challenging with the COVID pandemic because we haven't had visitors in the appointments with us, but thankfully now we do. But really trying to keep the family as involved as we can, because this is very hard for a woman to go through, and the more resources and help that a woman has, the better they go through. So we want to make sure the patient understands what's going on, as well as the people that are helping her with the recovery process.
And a lot of times, that's where we kind of came in with a lot of your patients. When they went home, we would go and check on them and then communicate back to you what we were seeing. So the collaboration between your team and our team really has been great. And I think the patients have really appreciated it.
Right. And people have lost their breasts, so emotionally, especially with the mastectomies, with the recon, you have kind of helped them take down the dressings, do self-care, and kind of help support them during the emotional time. But also there's some drains in place, which are draining body fluids that can be totally foreign or a little intimidating for a patient to have to drain and manage.
And sometimes they're not ready for their husbands to see it, or the husbands aren't ready to see it.
Exactly.
So, yeah.
And so what advice do you give people when they have concerns about whether it's important to get a second opinion or they're worried about their next course of treatment? Like, how do you coach someone through those decisions?
Well, I think second opinions are critical. With virtual visits now, we're able to deliver second opinions to people farther away too. A lot of times there's choices. Should you choose to do a lumpectomy, or is a mastectomy better? Is reconstruction There's various different ways between tissue and implants, above the muscle, below the muscle. And sometimes there's a gray area if chemotherapy is needed or not. So we encourage our patients to get second opinions because these are big choices regarding losing a breast or accepting chemotherapy for a woman to make. And you want to hear all the perspectives so that there's never a regret or second guessing of yourself.
What do you do if someone gets their second opinion? And I hope, all patients do, but now they come back and they're completely different. Do you go for how do you decide what to do?
Well, thankfully, we live in Chicago, and there's 5 academic centers within a stone throw away. And I think with breast cancer, there are gray areas. They want me to decide if a woman can have a lumpectomy and it's safe. I can express that it's safe and the survival is different. Some people want the mastectomies and get talked out of the mastectomy because they can have a lumpectomy. So I think if you provide, the great thing about breast cancer is there's a lot of evidence to support each decision, and we just empower the patient with the most education and hear where they're coming from and their perspective regarding the choices they make to help them make the best choice for them.
That's so helpful to hear. And I think we still have people that we talk to that say they're nervous about asking their medical team if it's okay to get a second opinion. And we just tell them over and over that the physicians that we collaborate with regularly really think that that's just a smart idea and that that's really the way to move forward with getting more information.
Right. And we're so lucky we don't live in a rural area. We do have the luxury of multiple institutions and thought leaders in breast cancer that live in our community. So why not take advantage of it?
Yeah, exactly. So with, in light of recent times with the global pandemic going on, some of the concerns are people delaying care, delaying mammograms, delaying procedures. What have you found in your practice? And, if someone talks to you about their concerns or their anxieties, how do you help them through that?
So I think it's really hard to convince someone that the medical center is safe. At Rush, we became a national leader in COVID. So people see our institution as a place where there's a lot of COVID patients. I'm grateful to work at Rush because we have done a very good job of taking care of the most critically ill with COVID patients. But what I really try to explain to patients is those COVID patients are in a very different part. They can even be 3 blocks away from where we're seeing our breast cancer patients and patients are receiving care. Also, screening is very important because if you think this pandemic is going to go away anytime soon, it's not. And we know that risk factors like untreated diabetes, untreated high blood pressure, untreated cancer can put patients at even higher risk for getting COVID-19. So I think the screening is done in a very safe way. We're practicing social distancing. They've extended the hours where a woman can get a mammogram so that fewer people are in the facility at any given time. Everybody is wearing a mask and getting temperature checks when they're walking into the hospital, and they're cleaning down the machines vigorously between each patient. So I would encourage a person to get their lung cancer screening, their colon cancer screening, their breast cancer screening in order to keep their body well so that if, gosh forbid, they do get this virus, their body's better able to fight it because they're not sick.
Yeah, that's such great advice. So because all of this is going on around us, how do you encourage your patients to, remain confident, try to get confident when they're grappling with some of these decisions?
It's hard. I mean, we're all grappling with a lot of things. A lot of people have lost their jobs. We don't know if our kids are going to be going back to school, and kind of what's going to happen with the virus in our community. So I think we have to take this time to take care of ourselves. Know that they're getting care in a very safe environment. The place where I do the breast cancer operations hasn't even seen a COVID patient. So we're trying to keep everything very clean and separate and hygienic, and that their breast cancer won't go away just because there is a pandemic going on. So we do need to take the steps to provide the safest high level quality care that we can.
Yeah. So anxiety and loneliness can happen at any stage of our lives and at, no matter what's going on around us. And I think that now with what's happening when we need to have even more social distance than before, how have you and the medical team managed anxiety and loneliness, which I can only imagine has gotten harder for cancer patients in this day and age?
So in our cancer center, we do have a great group of psychologists who work specifically with cancer patients. The diagnosis of breast cancer can cause anxiety with or without a global pandemic.
Right.
So we do have a robust group of people to help them talk through, help them do mindfulness. We have an integrated health department that can help with do yoga and different mindfulness exercises. But also our patients never hopefully feel like that they're alone. We do have these navigators that do call and check in on the patients, make sure that they're showing up to their appointments, and helping out with financial needs and psychological needs if it's required.
Okay. What advice do you have for patients that have done their screening and now realize that they do need to have surgery? What advice do you give for them as they prepare?
Well, I say make sure you understand what you're signing up for. We try to do as much preoperative teaching as possible to prepare them for the next steps, but also know that the most part, most women with breast cancer do very, very well. With good screening, we're able to find breast cancer early so that it can be cured with a really high certainty.
Oh, that's good. That's good news. And my mammogram is due next month, so I will definitely be coming in to get checked.
Me too.
I wish we could say we'd have a drink afterwards, but we can't do that.
No.
Thank you to Dr. Madrigrano from Rush University Medical Center. If you would like to connect with Dr. Madrigrano, email her at Andrea_Madrigrano@rush.edu. In the meantime, be sure to check back with us as we continue our conversations with medical experts as we help the confident patient in the new world.
And from all of us at 2x2 Health, we wish you great confidence and health. Thank you.
Thank you.